Hello everybody, I am Dr. Sampurna Ghosh, ENT consultant in Medicover, Hyderabad. Today I am going to talk about some common ENT diseases. One of that is ear infection, of course. Ear infection can be of few classic categories like outer ear canal infection, where the skin of the ear canal gets infected and gives rise to severe pain, purulent discharge, and you feel like the ear is blocked. The next level is middle ear infection, wherein there is no discharge, but behind the eardrum there is accumulation of pus. This is very common in children. Whenever they get cold, they can also have acute middle ear infection. The next level is inner ear infection, labyrinthitis or vestibular neuritis, which sometimes can happen after some kind of viral infection. For diabetic people, it is very important to take care of the ear. They should not ignore any kind of ear discharge or ear pain. They should not take over-the-counter medicine. Any diabetic person, if having discharging ear for more than a week, must visit an ENT specialist. Now, why we are talking about that is because, as we all know, diabetes by itself changes the body's homeostasis. It reduces our overall immunity. So even a simple infection can turn into an abscess. It can drag into some very bad complication. It is also applicable for the ear infection in diabetic. Sometimes they get greenish pus, which is very typical of a bacteria called Pseudomonas. Pseudomonas is a notorious bacteria because it is resistant to most of the common antibiotics which we give orally. Most of the tablets don't work on this bacteria. So it is important to take the pus from the ear of a diabetic patient to send it to the lab for culture sensitivity and see what kind of organism we are dealing with. The moment an ENT doctor will see the name Pseudomonas, will be very cautious to select the exact class of drug which will kill the bacteria, and mostly it turns out to be the injectable antibiotics. We can give it for 7 days, 10 days, regular follow-up visit. We stop it only when we are very sure that the completely infection has resolved. There is no more pus. In rare situation, even after 10-12 days of injectable, it doesn't go. It gives rise to a deep-seated pain. In fact, it can progress in the brain area through the skull base area, and it can causes various cranial nerve palsy. In that case, we call it malignant otitis externa. Here, the term malignant does not mean cancer. It means that it is a bad infection which can spread like a cancer, which can go through the skull bone. In fact, it can cross the midline and go to the opposite side. How is it diagnosed? It is diagnosed from the clinical judgment, from the microbiology report, and most importantly is from the CT scan or MRI. So the take-home message is that whoever is diabetic, having ear pain or ear discharge should not do self-medication or self-treatment. Take it little seriously and come to us in the early stage so that we can cure it without any complication. Thank you.